Hello, I am Rosalino Vázquez López, a researcher at the Universidad Anáhuac, Mexico. My team and I appreciate the invitation to the second edition of the COVID-19 International Congress. One of my line of research that I have developed with my friend, Dr. Marcos Felix, a pediatric oncologist, is the problem around the polyresistant septicemia associated with post-therapeutic neutropenic fever in pediatric oncological patients. Some publications have derived for this issue. It is a pleasure for us to share today the presentation entitled Management of the Pediatric Patients in the COVID-19 Pandemic, the Mexican Experience. Thank you.
So, thank you for the introduce to the Dr. Rosalino Vázquez Lopez. It's a pleasure to introduce ourselves with this presentation entitled The Management of the Pediatric Patient in COVID-19 Pandemic, the Mexican Experience. Our names are Andrea Cruz Hernández, Angélica Arredondo Domínguez, Oscar Cortés Cervantes, and Andrea Valencia Salinas, in collaboration with the Dr. Jose Marcos Felix Castro and Rosalino Vázquez Lopez. So we're going to start talking about cancer epidemiology. So as well as we know, cancer is one of the diseases that affect a significant part of the population, in agreement with the Global Cancer Observatory GloboCan in 2020. They estimate 19.3 million novel cases and almost 10 million deaths, which it means that 51.8% of the cases. It's important to mention that the female breast cancer has surpassed lung cancer as the most commonly diagnosed cancer, with an estimate of 2.3 million new cases, followed by lung, colorectal, prostate, and stomach cancers. Lung cancer remained the leading cause of cancer death, with an estimate of 1.8 million deaths, followed by colorectal, liver, stomach, and female breast cancers. Furthermore, childhood cancer is estimated to be the 5% of the total cases, which it means that approximately 400,000 children between the ages to 0 to 18 are diagnosed with cancer every year. The rate of survival depends on the region, with an 80% survival in most high-income countries, but as low as 20% only in low and middle-income countries. Actually, the pattern of cancer in childhood differs considerably from those among people of all other ages. In general, leukemia constitutes about a third of all cancer childhood. The other most common malignancies are lymphomas and tumors of the central nervous system. Several tumor types occur almost exclusively in children, including neuroblastoma, nephroblastoma, medulloblastoma, and retinoblastoma.
In Mexico, childhood cancer is the leading cause of death from disease between the ages of 5 to 14 years old, claiming more than 2,000 lives annually. Only 5% of cases occur in children. Per year, more than 5,000 new cases are registered in patients under 18 years old. The most common type of cancer are leukemias, with a 48%, lymphomas, with a 12%, and central nervous system tumors, with a 9%. According to the data of cancer registered in children and adolescents, the incidence rate per million was of 111.4 in children between 0 to 9 years old, and the group of adolescents between 10 to 19 years old have an incidence of 68.1. The states with the highest incidence rate of cancer in children from 0 to 9 years old of age are Durango with an incidence of 189.53, Colima with an incidence of 187.42, and Aguascalientes with an incidence of 167.86. 0.36, while the entities with the highest incidence of cancer in adolescents from 10 to 19 years old are Campeche with an incidence of 149.55, Colima with an incidence of 117.27, and Aguascalientes with an incidence of 106.21. Regarding mortality per 100,000 inhabitants, adolescents between 15 and 19 years old had the highest mortality with 6.88. The 10 to 14 years old group had a mortality of 4.54. The 5 to 9 years old group had a mortality of 4.60, and the group of 0 to 4 years old group had a mortality of 4.35. The states with the highest cancer mortality rates in children ages to 0 to 9 years are Campeche with a mortality of 6.3, Chiapas with a mortality of 6.2, and Aguascalientes with a mortality of 6, while the states with the highest mortality rates in adolescents between ages of 10 to 19 years old are Campeche with a mortality of 8.6, Tabasco with a mortality of 7.6, and Campeche with a mortality of 7.
Given that patients with cancer are generally more vulnerable to infections, the impact of COVID-19 on these patients must be considered. The disease appears to be affecting the majority of children less severely than to adults. Nonetheless, the impact in pediatric oncology patients is still dubious. Data regarding coronavirus disease descriptions are still limited in pediatric oncology. Considering that, we're taking into account children with immunosuppression, which should be at higher risk to present the severe form of COVID-19. However, several studies have shown that oncology pediatric patients with positive COVID-19 are not at any more risk of serious infection than ordinary children. Nevertheless, some of the patients do require hospitalization in the ICU, and just a small percentage reaches death. Even so, a great majority present a mild or asymptomatic infection. A major risk to develop severe infection of COVID-19 has proven to be the ongoing treatment for active metastatic solid tumors or even hematological cancer. In spite of this, there does not exist sufficient evidence to allow us to fully affirm this, given the low incidence of the infection in the oncological pediatric population. Besides, given that all nations' efforts are directed to the management of the pandemic, treatment for cancer patients has been delayed, and it may have an impact on the long-term prognosis of patients. Therefore, it is of extreme importance to continue with the treatments of cancer patients, always taking the preventive measures.
The appearance of PIMTS differs mainly from Kawasaki disease in the age of appearance. Kawasaki disease usually presents in very young pediatric patients, while PIMSTS appears in adolescents or pediatric patients in age close to adolescence. It also includes common signs to Kawasaki disease, such as fever, dilatation of conjunctival blood vessels, rash, and redness of the oropharynx. In the same way, but in fewer cases, coronary artery aneurysm has occurred without knowing the cause. While in Kawasaki disease, it occurs due to inflammation of the blood vessels, it has been seen that in PIMSTS, it usually occurs with very high levels of atrial natriuretic peptide and leukopenia, while in Kawasaki disease, this does not occur.
Hi. How this pandemic has effect of our pediatric cancer patients? This is an example from our country, Mexico. This is a 6 years old boy with 6 months of coughing. And right now we can see the Hodgkin disease that has diagnosis in this little patient with the all right hemithorax taken by the disease. In the second cases, we can see 12 years old girl with pelvic pain, with a perennial mass, and 5 months after the beginning of their symptoms, can we can do the diagnosis of pelvic abdomen sarcoma. The late of the diagnosis in these two cases, and the last case is a little girl of 4 years old. That we have working with her treatment with a treatment for her leukemia, and in a relapse of the leukemia, we found even more, because he was affected by COVID in this computer tomography, and then at the same time with a bacterial pneumonia, community acquired pneumonia, in a patient with a relapse of the leukemia. This is the effect on in our patients. We have a vulnerable population that has suppression of the immune system, and this caused more severity of the infections. They have to go to the hospital more time, more visits. Even they used to use faces, mask, and social distancing even before this pandemic era. They affect because of it right now too. We know that we're going to find higher mortality in our patients because of these issues. This study, this article published in the Lancet in past May 21, is a survey that was possible because of the alliance of St. Jude Global and International Society for Pediatric Oncology. They made 60 questions trying to find diagnosis, disruptions, adaptation, and change resources in the world. They find 311 answers from professional or from health professionals in the world. It was about 213 hospitals working or answering these surveys from 79 countries around the world. In the green color, we can find how they answer the survey, and in white color, the countries that no answer were found in this survey. And the effects in the institutions. 187 centers has tests for COVID. They had two infection for institution for the average from 0 to 350 cases in some hospitals. Uh, total of hospital closed by this pandemic was 15 only, with a media of 10 days, from 1 day to 75 days in some institutions. 2% of the hospitals has no new cases of cancer. That's strange. And 43% decrease the diagnosis of the cancer in their patients or in the population around the hospital or in the country. Decrease in the treatment or change in the treatment was seen in 34% of the hospitals. The changes were, for example, in surgical attention in 72% of the answer. Blood products, for example, decreased in 60% of the institutions. Modifications of the chemotherapy treatment was seen in 57% of the cases, and changes in radiotherapy were seen in 28% of the institutions. This was more frequently in low and mid income countries. What about the changes in the institution? For example, an issue that was seen is that no matters how many cases in total populations in the hospital or in the countries, there were no changes in the hospital for each cases. For what change that they made in this pandemic, for example, they changed the checklist for the process or for the hospital process. Communication process were changed in 63% of the cases, and essential service has changed in 56% of the answers in this survey. What other changes they seen? For example, in 106 hospital, the resources change. 33% were found in the financial support, not only in the government or in the institutional way, even in the civic or civil association that helped the hospital or helped the patients. 66% of the staff has a reduction in some periods of times. For example, 60% of the personnel was infected in 1 or 2 points of the time in the pandemic issue. Sadly, 8% of health professional that died for the pandemic infection. And in the protective equipment that they use, 50% of the cases they don't have the complete equipment or in the right time the equipment in their hands to work with the patients. 19% of the answers talk about less oncology beds for their patients. What are the barriers that they are facing or we are facing in all this pandemic period? The prioritizations of the resources are different, and we have to work with these differences. The lockdowns, not even in the hospital or in the country, even in between the countries, in the borders, make different and make more difficult the treatment of our patients. The restrictions in the transport of even in the same city, for example, failure in the enrollment in protocols or in research in pediatric oncology was lower, and that will affect the outcomes of the research. For example, we know that we're going to have bigger effect with more time. In 1 year, we're going to find more things to talk about, or even earlier in 6 months or something like that. We have to think that the effect will be worse, will be bigger. And it's worse in lower or mid-income countries, for example, our country. The economical issue is important in these answers. We have to learn more. We have to try harder. We have to open the possibilities and be trying to research in our patients. They are affected not only in the psychological way, not only in the economical way, in the treatment, in the support of the disease. We have to take care of these outcomes in time. The only way to recover some of the opportunity that we have lost is today. Is with our work, with this kind of symposium, congress, and with information trying to share, because the future of all children starts now. Thank you.